Good evening, ladies and gentlemen. Welcome to another evening Rotary meeting. My name is Dasun and I'm the MC for tonight's event. Before we officially start the proceedings, I would like to acknowledge the Wurundjeri and the Bunurong people of the Kulin Nation, and also pay our respects to the elders past, present, and future. And also respect to all Indigenous Australians present today. This is the second meeting of the Rotary year, and today we have a very interesting speaker, Cameron Glover, who is the CEO of Interplast and also one of our Rotary members. Sana will be introducing Cameron in a while. So it's been a while since actually been here. So I just want to say recognize the team of members who are organizing the evening meetings. It's I think for the last time we have two separate teams organizing evening meetings and the normal lunch meetings. I would like to recognize Sana, Yidan, George, Stefan, and Sap, who's the newest member. Without further ado, I'd like to invite Sana to introduce our guest speaker for the day. Sana?
Hey, I'll just start by giving apologies from Yadan. I'm sure she won't mind me sharing this with you guys, but she stopped taking wine at Chateau Earring tonight, so tough luck. So Cameron Glover, who was appointed CEO of Interplast Australia and New Zealand in December 2019, just a few short months ahead of the emergence of COVID-19. Tasked with unexpectedly pivoting a well-established organisation known for its provision of life-changing surgical and allied healthcare for 17 developing nations in the Asia-Pacific region, Cameron and his team navigated the challenges of the global pandemic and its impact on patients. They needed essential care, build fragile health systems, and an overwhelming surgical workforce, which was required across a number of low-income communities. Today, as we look beyond the immediate impacts of COVID-19, we ask, how has the global pandemic changed surgical care into the future? A warm welcome for Cameron Glover.
Thanks, Anna, and thanks to everyone. As someone that presents to Rotary clubs a lot, it's actually really nice to be able to present to your own club. And I'm somewhat ashamed to say it's not often enough that I get to the club. So it's really nice that I can make it tonight. Hopefully, as the year goes on, you'll see a little bit more of me, particularly at the nighttime meetings. I also want to acknowledge the many guests that we have on the line this evening, who I've got to say, I'm delighted to see a number of our Rotary connections through Interplast that have come along to this as well. If I can, before I start, let me get you to ponder your own life for a moment. So the parents amongst us, think about the birth of your child. It's probably amongst the happiest days of our lives, and it gives a love that you've never before experienced, it's safe to say. Now, for many of us, that love comes through the support of highly skilled surgeons, anaesthetists, and nurses. If it wasn't for them, our child wouldn't have arrived in the world safely. Now, as the child grows and experiences the hiccups and various mishaps, some of those result in a simple band-aid, some of those require x-rays and plaster, and for the more serious, they require surgical intervention. Our own lives involve trauma, congenital defects, and perhaps also preventable and treatable disability. But wherever we are in Victoria, we know that no matter how stretched our health system gets, there will always be a surgeon, a nurse, or an anaesthetist to look after us. What happens though for those that aren't in Victoria? So highly skilled surgeons, anaesthetists, nurses, allied health professionals are there to repair bodies and rebuild lives here, but what about elsewhere? What if we lived in the Solomon Islands or Bhutan or Nepal, Sri Lanka? What about if we lived in Fiji? So across the Asia-Pacific region, surgical care isn't always accessible. A lack of skilled clinicians, an unsustainable health system, distance, cost, and simple lack of access means that patient outcomes aren't guaranteed. So if we can't get surgery when we need it, that's surgical inequality. And sadly, for our nearest neighbours across the Asia Pacific region, that is what they live with daily. But surgical inequality is a really depressing topic. It's not what we want to be talking about on a Wednesday night in a beautiful location, particularly as Yadan is counting wine elsewhere and we're all thinking about what that should be. Let's instead talk about time travel. So tonight we're going to go on 3 very distinct journeys. Firstly, we'll take a journey to the past, a time when Rotarians thought big, they saw an issue, they created a solution, and they ran with it. We'll then move forward a little bit to a time when travel was without restriction, rats were vermin and not life-changing medical devices, and in fact, the only people that wore masks were superheroes in capes. And finally, join me as we look into the future on our time travel, one where the world is positively different, and there is in fact a world where those requiring healthcare can get healthcare. So with that in mind, let's go back. Sorry.
Want to go back, Cameron?
No, we'll go forward.
Okay. Doesn't seem to want to respond.
All right, let's move ahead anyway, and we'll let the slides catch up. So let's go back to 1983. So 2 incredible things happened in 1983. Firstly, I celebrated my first birthday. It was a day filled with love and parents and balloons and probably terrible party food and fairy bread and that sort of thing. But the reality is none of that's relevant to tonight. What actually happened in 1983 was the birth of Interplast, the birth of an organisation that was started through Rotary. And for that reason, 1983 is where we first go as part of our time travel. So in 1983, as a direct result of the vision and the commitment of Rotarians across Australia and New Zealand, Interplast was created in this very district, in what was 980, but later became 9800. Interplast came into existence. Now, the Interplast story is well known. It's certainly well known to many of you in this room, and it's well known to many of you online. Traditionally, as an organisation, we've sent surgeons, specialist reconstructive surgeons, anaesthetists, nurses, and allied health professionals to low and middle income countries. We provide surgical care where it's not available. Now, as a direct result of that commitment, Interplast Australia and New Zealand to date has provided over 27,000 surgeries to those in greatest need. Most importantly, our incredible clinical volunteers have provided more than 8,500 training opportunities to partner doctors and medical personnel across the region. The impact of Rotary and the impact of Rotary and Interplast can never be underestimated. So although the Interplast story is well known, perhaps less well known is the role that Rotarians continue to play today in the organisation. Our structure requires that approximately half of our company members, so those that elect the board, are Rotarians. On the board, we have a minimum of 2 past district governors. They are supported by up to 9 past district governors that form part of the Interplast Rotary Committee, which is a board-appointed committee that supports our work across the region. And further, I have a Rotarian coordinator on staff, herself a Rotarian and herself here tonight as someone that engages with the 1,100 clubs across Australia and New Zealand. In addition to that, across the 21 districts, we have an Interplast district chair in all districts where we work. So when we think about Interplast, we can't think of Interplast without Rotary. Put simply, without Rotary, there is no Interplast. Without Interplast, there's no access to life-changing surgery amongst the countries where we work.
Should be working now, Cameron.
So as we look back over the last 39 odd years of success, we do so in the knowledge that Rotarians have been alongside us every step of the way. Patients like Roxon, who you're seeing on screen at the moment, is a young boy from the Solomon Islands. He would have lived a life without the ability to have his cleft lip and palate repaired. But through Interplast, we managed to repair that. And through Interplast, through Rotary, we've given Roxon a difference and we've allowed him to live a life that he wouldn't otherwise live. So in 2019, as we continue our time travel, two things happened. In December of that year, I was appointed CEO of the organisation, an organisation with a proud history but also an exciting future. 2019, though, will also be remembered for a change that no one saw coming. On December 31 of 2019, we first started this phenomenon of viral pneumonia that was starting to appear in Wuhan, China. It was unsettling, but it was nothing to be worried about. That was the official advice. How wrong we were. So to put it in real terms, as things moved very quickly, we first started to see that on the 31st of December 2019. By the 13th of January 2020, we had the first confirmed case of COVID, or what later became known as COVID, first seen in Thailand. But on that time, the advice from the World Health Organization and the advice from our own clinicians was that human-to-human transmission was not a thing. COVID-19 was not going to affect the human population because it wasn't something that we needed to be concerned about. That was on the 13th of January. By the first week in February, the World Health Organization was giving daily press updates, and that's the first time in the history of the World Health Organization that they started to talk to the press daily. On the 11th of March 2020, COVID, as we now know it, was actually declared a global pandemic. So in a really short period of time, as we all remember, the world changed. And it changed in a way that none of us would have seen coming. So it changed in a way that as of today, as of tonight, COVID has impacted 567 million cases of COVID have been found across the world. Sadly, 6.35 million people have died as a result of COVID. So the world as we knew it as an organisation changed. That was the easy bit. Sadly for many, the world as they knew it stopped. The world's attention rightly turned to stopping the spread, to reducing the curve, and to getting vaccines into arms. That was the right decision then, and it remains the right decision for today. But as the world was laser focused on responding to COVID-19, what did that mean for surgical access? What did it mean for treatable disability? What did it mean for patients like Roxanne? It mattered then, as it does today, because as of today, 5 billion people around the world don't have access to safe, accessible and affordable surgical, anaesthetic or nursing care. The other reason it mattered is that 143 million additional surgical procedures are required in low-income settings every year. They are going undone. And what's perhaps more distressing is that just 6% of the world's surgeries occur in low-income settings. Just 6% of the surgeries that are conducted are actually where they need to be conducted. So that's why it matters. But in 2020 to 2022, we had a decision to make. And like many organisations, Interplast had perhaps the toughest decision to make. First, we could pivot and deliver surgical outcomes without a traditional surgery, or we could close the doors and wait it out. Now, perhaps my greatest moment of pride is that we chose the former. We decided to pivot, twist, turn, pivot, leap, repeat. Interplast was able to help our friends across the Asia-Pacific region, and we chose to deliver patient outcomes at a time of little positivity. So our promise to our international partners was a simple one. We wouldn't leave them behind. We wouldn't forget them. Whilst we can't physically be alongside our partners, we would never leave their side. Our focus became fourfold. First, we would continue to ensure that patients in need were able to receive life-changing care and that it would be timely and accessible. We worked to build sustainable surgical workforces across the Asia-Pacific region that could respond both to the immediate need, but also to the future medical needs in those countries. Interplast committed to supporting enhancing hospitals and clinical institutions by supporting the provision of equipment, supplies and expertise. And perhaps most importantly, we continued to partner with governments to create systemic change. Good quality patient care only occurs when health systems are sustainable. And so we focus on sustainability and capacity building. Now, as with all Interplast services, we only work where we're invited, and we only work in a way that the partner requests. Unlike a lot of aid and development agencies, we wait until we receive an invitation to work in country before we go and work there. So as I mentioned previously, Interplast has traditionally worked in 17 countries across the Asia Pacific region. We work as close as the Solomon Islands and Fiji, Bhutan, Vanuatu, Tonga, Kiribati, and some of the local Pacific nations, but we also work as far afield as Mongolia, Bhutan, Nepal, Sri Lanka, Bangladesh, and others. So in 2020, we worked in 17 countries, but COVID did something really unique for the organisation. It made us work in 38 countries. We continued to work in all 17 traditional Interplast countries, but we also started to work in an additional 21 countries. Suddenly, at a time when everything was shrinking, Interplast grew. Sculptural to skin wasn't possible, but what was possible was the use of technology. And it's the use of technology that perhaps is what our past 2 years really looks like. So in 2021 in particular, Interplast delivered in excess of 15,000 hours of mentoring to clinicians across the Asia Pacific region. Every international clinician that partnered with us was able to engage with a one-on-one or group mentoring by an Australian or New Zealand-based surgeon, anaesthetist, nurse, or allied health professional. Not one that requested that service was turned away. Additionally, our volunteers, so those same volunteers that are working tirelessly in Victorian and New South Wales hospitals, managed to deliver the equivalent of 90,000 hours of webinars over the course of the year. Medical training now wasn't just accessible, it was accessible on a mobile phone, and it was accessible with low-band internet. It changed the way healthcare professionals were able to receive their training going forward. And I'm thrilled to say that it will continue to change the way that Interplast delivers services. So whilst there was an obvious focus on building capacity of health workforces, there was something else that we needed to look to. And that was the fact that patients were still going untreated. So in a year that we, pre-COVID, we would normally treat close to 1,000 patients a year. That obviously changed. But in the 2021 year, Interplast was able to ensure that 67 girls and boys, women and men, received surgical intervention when it was most needed. The reason that became possible was through Rotary. Rotary funds and Rotary partnerships across the Asia Pacific region that we hold were able to ensure that patients that wouldn't otherwise get access to surgery because they couldn't afford it or it wasn't accessible, still, despite the challenges of COVID, were actually able to receive life-changing surgery. And that's a pretty special and exciting thing. And as we look to the future, perhaps the tradition of Interplast always flying in and flying out to deliver service, now we may be able to deliver service in a different way. And the reason that's important is because it means we can scale further. So remember, if it's without Interplast, there is no provision of medical services in some of these countries. Without Interplast, there is no treatment of treatable conditions. But none of this happens unless it was for Rotary. None of this happens without the support of Rotarians. So finally, as we look to our ongoing time travel, as we look to not only 1983, but also 2019, now let's look forward to 2030. And the reason 2030 is an important year is just the same as 1983 being an important year. Just as 1983 was an important year in Interplast's history, 2030 will be one that shapes the future of healthcare across the region. And the reason we know that is because 2030 is when the Sustainable Development Goals come to an end. 2030 is when the global health indicators are reported on. And 2030 is the year that we're all working towards that will allow healthcare to be accessible and timely. And the reason that we can do this is that by 2030, we know, and we know that you know, that healthcare should be accessible and equitable and patient-centred and available to all. So next year, as we turn 40, what does that actually mean? Well, it probably means that our best work is still to come. So by 2030, we have some pretty ambitious goals. We will treat an additional 20,000 patients, scalpel to skin, across 17 countries or more across the Asia-Pacific region. We will train a further 7,500 clinicians across the Asia-Pacific region, surgeons that perhaps wouldn't otherwise access specialist plastic surgery training will have that available to them. The other thing that will happen is anaesthetists, nurses, allied health professionals, so physiotherapists, hand therapists, speech therapists will all receive training through Interplast. Between now and 2030, we will continue to support an additional 80 hospitals across the Asia-Pacific region to enhance their practice and to deliver safe and effective reconstructive surgical care. And perhaps most significantly, over the next 8 to 10 years, we'll proactively work with 20 countries to do ourselves out of business. Success for us would be not to be needed at all. The greatest thing I could do for the organisation is to close it down. The greatest thing I could do for the organisation is for the health systems where we work to be fully sustained and self-sufficient. Now, I can say that won't happen in all countries by 2030, but it will happen in some of the countries where we work. So whilst the goal is daunting and the numbers ambitious, it's quite easy how we'll get there. We'll start with one, because it just takes one. It just takes one patient in need, and it just takes one surgeon with skills. It takes one nurse that will care. It will take one Rotarian with vision. It will take one club to drive change. And perhaps most importantly, it just takes one. So the goals are big and lofty. Yeah, it's ambitious, and it's, to be honest, as the CEO at times, it's slightly scary. But it just takes one. And in fact, it just takes you. Thank you.
I've got a couple of questions, probably one from me. You talked about synergies between Rotary and specifically Interplast in terms of 1983. What's the future look like with that capability and partnership looking for that success from the 23 with Rotary? What does that look like? What do you need for Rotary to achieve that?
Yeah, look, I would be shocked as a CEO if I said I needed anything other than money, but that's not true. We do need more than that. What I think Rotary brings to Interplast, as it brings to every organisation it supports, is the network, is the collaboration, is the opportunity for scale. And so for us, we talk about surgical accessibility and equality. If you're an islander that's living on a far-flung island, Solomon Islands, the only way you can get to hospital is by boat. And often it's our Rotary connections that actually allow us to get patients to hospital. So yes, we need money, but we also need the connections, we need the contacts, we need the scale. And that's what we can do.
Thank you. Do we have any questions in the room to ask Cameron?
Cameron, understand how Rotary got involved in the beginning of this. How are you funded?
Yeah, so look, our funding is largely sort of private individuals and Rotary clubs and districts across Australia and New Zealand. So in any given year, about a third of all Rotary clubs across Australia and New Zealand actually give to the organisation and through their various commitments. We receive a tiny little amount of funding from the federal government, and that has shrunk over a number of years. But the vast majority of our funding comes from individual donors that give $20 through to a couple of $100,000.
Cameron, the question is, looking right now, where we're at with COVID, and the various influences and factors of going on, travel's opened up, transport's opened up, overseas travel, but the hospital system here, like in Victoria, is under pressure again. What's it look like right now in terms of Interplast and what we can do?
So I'm thrilled to say we will get our first teams out and back overseas later this year, certainly prior to Christmas. And they'll be the first teams that have travelled since March of 2020. So the first team is likely to go back into Fiji initially, and then we'll focus on the Pacific Islands sort of in the initial 6 months before our return back into Asia. It's an interesting one at the moment because, to your point, the Victorian system is stretched, and so pulling clinicians out of Victoria to go and work elsewhere is a challenge. That said, they are so ready to go. The volunteer clinicians that Interplast engage are the best in the world. There is no question about that. And they are devastated and have been devastated over the last couple of years that they haven't been able to go and work in the way that they traditionally would. And to put that in context, in August of 2019, I was in the Solomon Islands with one of our teams. And we saw a 4-year-old boy by the name of Lloyd. And Lloyd is the same age as my son currently is. And we saw Lloyd, who had a very treatable disability. It was quite a significant tumour, but it was treatable, and it was covering one side of his face. And we were able to, our surgeons were able to work on that side. But we knew that we had to go back the following year to perform an additional surgery so it wouldn't regain and wouldn't come back. Now, unfortunately, we haven't been back for 2 years. So the surgeons that performed that work are desperate to go back because not only is there Lloyd, who should next year be starting school, should be engaging in his community, should be working, should be starting to enjoy all things that little boys are known to enjoy. The reality is, if we don't see Lloyd in the very near future, Lloyd may not have a future, and that's devastating for our teams. And so they're, the minute the borders opened, they're wanting to get there.
Cameron, Dustin here. Apart from all those challenges we highlighted, in the immediate future, what are the other operational challenges you see as you guys try to do what you do?
Yeah, look, the biggest challenge is actually one of logistics at the moment. So as an organisation, we've relied heavily on the support of airlines, and I'll often say, if anyone goes to an airport and you see an Interplast team, do everything you can to get in front of them at the check-in queue, because chances are we'll be carrying somewhere between 350 and 600 kilos of excess baggage with us. And the last thing you want to do is check in after we've been there. One of the challenges has always been that the airlines have waived those excess baggage fees. They're no longer in a position to do that. So the cost of travel has gone up for us. The ability for us to get to remote islands that perhaps we traditionally got to through smaller airlines, as a result of COVID, those airlines are not flying. So it's purely a logistics exercise to see how we get back. But the other thing, we're not sure in some cases what we're going back to. So the hospital systems and the hospitals that we've worked in across Asia Pacific are stretched at the best times pre-COVID. Their workforces have been decimated as a result of COVID, and the equipment and supplies have disappeared. And even today, we received a comment from our partners in Sri Lanka, and that's not COVID related. But in Sri Lanka, they're unable to purchase medical supplies to perform the surgeries that they know need to get performed. The other thing that we sort of navigate as we navigate the challenges of what we traditionally think of as COVID challenges, in that time, Myanmar, the government has been overthrown, and there's a military sort of coup that is now in existence. We don't know what we're going back to, so we almost have to go back, re-establish relationships before we get back to the sort of strong medical way. In the year prior, we did 80 surgical programs across the region.
Just checking with.
I'll just ask, are there any main hurdles you have dealing with countries that obviously have a lot of red tape and a lot of corruption? With all due respect, that's just how the nature of a lot of third world countries, I guess. So do you see any main themes and challenges?
Yeah, look, we do and we don't, and that's very much a CEO sitting on the fence, that answer. What we do see is a lot of turnover of staff within ministries of health. And so, you develop good relationships, they're no longer there because of What also happens though is that you see within the workforce, particularly in the health workforce, there's a real opportunity when people are trained within some of those countries to go and work elsewhere. And particularly in the Pacific, it's quite easy for a Pacific Islander to go and work in New Zealand. And so there's a real exodus of talent in the Pacific into New Zealand, and that creates some challenges. That said, you know, the risks associated in working in developing nations that don't have robust risk systems, or fraud and anti-predictive issues like that, they're not unique to our work, and I hate to say it, they're not unique to developing nations either. A lot of the challenges that we experience here are exactly what we see in those countries. It's just on a different scale.
All your volunteers in Australia, or they come from everywhere else? If so, have you plans to go for it?
Yeah, certainly. So most of our volunteers are Australian, but we have an incredibly strong and growing New Zealand cohort as well, which is fantastic to see. We haven't necessarily proactively gone out to sort of recruit volunteers. Interplast is incredibly lucky in that it's almost seen as something to be really proud to be a part of. And so up until now, over the 40 years of the organisation, we've never actually had a shortage of medical volunteers that are willing to go. So we've never had to sort of test further afield.
Thank you, Cameron. My daughter's not well, so I was checking what's going on at home. So my apologies. Look, thank you very much. Great chat. I'd like to invite President Adrian. I was very close to say President President Adrian to close the meeting. Thank you.
Thanks very much, Dasun, and also to Cameron, and to those who are watching online tonight. There's some familiar faces that we see, particularly it's a shame Murray can't be here with us, and others. And I see we've even got a past district governor from outside our district. So it just goes to show, Cameron, that the impact that Interplast does have across the Rotary world is immense. And we're always talking about in Rotary that we're people of action, and it's about the impact that we make. And I think Interplast is really the ideal sort of program, the perfect program that shows you the actual impact and actual results that the work we do can make. So thank you for your time. It also, I guess, highlights to us here at Rotary Melbourne. Cameron, of course, is a member of Rotary Melbourne, so we do have some fantastic members. And often you find that the best speakers are those that come from within our club as well. So thank you, Cameron. We've got a presentation for you as well. So as with any guest speaker, the wonderful past president Phil Endersby and his company Wilderness Wear, we have the, I'm told they're 200% made in Australia socks. I think we've still got the R100 socks, but we've got some special new ones coming soon for 2023. So you'll have to come back and speak and so you can get a second sock to wear. So thank you. So for me, this is my first evening event that we've had. We're not calling them meetings anymore. This is our first evening with, and so it's an evening with Cameron Glover, and every month we're going to have more evening withs as the year goes on. Next week, of course, we refer back to our luncheon meeting, and we've got Mark Marvel. Is that right? Melville. Sorry, I apologise for that. Who's the CEO of the Committee for Melbourne, who'll be talking at our club. And so the Committee for Melbourne has a membership of some of the major organisations across Melbourne, as a real think tank about the types of things and where our future is for Melbourne. So I think Mark's going to be an amazing speaker, and we're really looking forward to it. So those of you online, please come in and join us at the Sofitel. And also those of you who are here in the room as well, please come along too. So with that, I think that just about finishes up. We've got next week, we've got the meeting. We've also got, towards the month goes on, we've got the tree planting, which we've got Peter Burke here tonight. So We've got a tree planting in Wantirna on National Tree Planting Day, so there's still volunteer opportunities for those who'd like to do that. And we also have our Arts Committee has a special trip to the NGV where we're going to do the Picasso Century exhibition. So there's still places available for that. That's this month in July. So just go to the Rotary Melbourne website for more information and book in for both of those. And with that, I think it's probably time to relax, put your feet up. Those of you at home, you can get your upgrades on if you don't have them on already. For those of you who are here in the city, have another drink, go out to dinner, enjoy the night, and thanks very much for your time tonight. Thank you.